Welcome to Healing Mindset, where we explore the deeper intelligence of the body and the pathways that lead us towards true, lasting wellness. I am Nazish, and today we are joined by someone whose work is reshaping how we understand illness, imbalance, and healing. Dr. David Bilstrom is an internationally recognized physician specializing in autoimmune and chronic disease, a pioneer in functional and integrative medicine with quadruple board certification. For decades, he has been helping people to see what so many of us miss, the symptoms that aren't the problems, they are communication. Messages from the body asking us to pause, listen, decode the root cause, and restore alignment. This conversation may change the way you interpret every single ache, fatigue, flare, or discomfort, the whispers long before they become loud cries. Dr. Bilstrom, welcome. I am so thrilled to have you here.
Oh, it's wonderful to be here.
That is amazing. So, David, when you say symptoms are body's communication, what does that fundamentally mean from a functional medicine perspective?
Well, the body is very good at staying healthy, and its default mode is always to move towards wellness. So ideally, it's just self-correcting every day. Now, when the body starts getting a bit overwhelmed by problems that are going to try to create a chronic health issue, it first starts letting us have some small symptoms. And those small symptoms, are not life-threatening. They're not gonna probably stop us from doing our work every day that what we need to do, but we have become very good at not listening to our body. And I use kind of as an example, like a nurse. And a nurse,
Mhm.
a busy hospital's setting, she has to go to the bathroom, but she can't because she's too busy. Well, she also might say, "Well, I'm hungry. Well, I can't. I'm too busy. I'm not gonna have lunch today. I have to sleep. Well, I can't. I'm on the night shift." And so these little things, you kind of push them to the side. And this could be things like not sleeping well, fatigue, a joint pain, you know, uh, a little depression, a little anxiousness. It could be anything. And that's our body sort of saying, hey, we need some help here because we're having a little hard time taking care of things. We're fighting the fight, so we're not gonna let it take you down yet. But please listen to what I'm saying so you could fix why I have this. And then all the little whispers that are going on at the same time, because they're all connected, are all gonna get better at the same time. And then by listening to your body, fixing what's causing a lot of little things, they go away. But then you've really set your body in a good position to stay healthy and not let these things build over time and they get catastrophic eventually.
That is such a liberating perspective. And trust me, where you said the example of nurse, I feel like that many people working professionally go through this, not
Mhm.
sleeping and not eating on time. And these are these few little things that we just avoid, which brings out as a bigger impact later on.
Very much so. Yep, little things become big things if you
Yeah,
take care of them.
exactly. So, do you find that the biggest shift for patient happens when they stop seeing symptoms as enemies and begin viewing them as guides?
I think that is a huge shift in our thinking, and I think for multiple decades now, and this is doctors, medical people, and non-medical people, is oh, you have a small issue or a big issue. Well, here's a medicine. Here's a bandage, and it's going to put a bandage on the symptom. Like, well, I don't really sleep well. Well, here's a sleeping medicine. Oh, I now sleep better, but that didn't take care of why you didn't sleep, right? And also something like, um, I'm anxious, I have anxiety. Well, here's a medicine like Xanax that's gonna help you not feel anxious. But that really didn't take care of the problem. Your problem wasn't a Xanax deficiency. It was something, but it wasn't a Xanax deficiency. But then in our world, we say, well, what's the big deal? You're not anxious anymore now that you started this medicine. Well, you're sleeping better. on this medicine. Well, you are, but it didn't take care of why. And that why is just going to keep pushing you the wrong direction. And so medical doctors kind of think that way. They don't think root cause. They just think, well, what bandage can I add? Because this person needs help. But also for the people themselves, they've been kind of taught that this is really the only option. What else do you want? This is going to help you. And it only takes one pill. You should be happy it only takes one pill. Well, the mindset shift should be, well, if you're not sleeping, that's okay to take a medicine. If you're so anxious, so much anxiety, panic attacks, you can't get through your day, the medicine's fine. But it really should just buy you time to go back and try to answer the question, why can't I sleep? Why am I anxious? Why am I fatigued? Why am I brain fog? Why am I depressed? And then you're going to feel a lot better because a bandage doesn't really make you feel great, great. It just gets you through your day. But now you go back and now you feel great, great. And then you don't even need the medicine. And then you don't need the side effect of the medicine as well, because they all have side effects. And so it's a bit of a paradigm shift in the way that doctors and non-doctors think. But we've just been kind of taught to think this way for multiple decades now.
That is actually very true. And I feel like that mindset shift really becomes the foundation of deeper healing.
Very much so. And it's interesting when I lecture to like doctors and medical people, I'll tell them, for example, uh, uh, I lectured in Paris back in the summer of 2024, and I lectured on the four maternal microbiomes, the mix of good, bad bugs in four different parts of the maternal body during pregnancy that drive either the fetus to start being put in a position to develop chronic health issues even before they're born, or put them in a position to set the system up really, really well so they just don't get things during their lifetime, prevent disease their whole life during pregnancy. But all the things that I would say that throw this off are so common, and they go, well, geez, this is why we have so much autism, and this is why we have so much ADD and ADHD and depression and anxiety and bipolar and schizophrenia and cancers and all this. Now they understand why this all happens, but then invariably somebody raises their hand and goes, You can fix this?" And I go, "Well, of course we can fix it." I wouldn't be explaining why this happens if I didn't also explain how you can make it not happen, right? How you can reverse it. But their mindset is, "Well, we shouldn't be able to fix that. We can really fix that?" And I'm like, "Of course. Of course we can."
Yeah, mindset plays a really big role in a lot of things. Uh, so, autoimmune and chronic conditions often develop slowly. What early symptom patterns do people tend to dismiss that are actually meaningful messages from the body?
Yeah, so the body is good at fighting a fight to keep us healthy. And so ideally, when somebody develops a very first symptom, brain fog, mood issues, fatigue, joint pain, a skin issue, anything, usually it's been 10 to 20 years in the making. The body's been fighting the fight for 10 to 20 years, trying to keep things quiet, doing its very best. But now there's enough things kind of built up that are not good going on. The person feels their first symptom. And so, truly, any symptom of any kind that is just not how you should be feeling could be is the first symptom of chronic disease. And what we understand about the immune system is it's really tied into every chronic health issue. We used to think that like autoimmune disease is rheumatoid arthritis, psoriasis, multiple sclerosis, um, uh, ulcerative colitis and Crohn's disease, Hashimoto's, different body parts. Well, now we understand that immune system disruption is really part of all chronic disease. And so, like, for example, autism, 70% of autism is one particular autoimmune disease. Autoimmune and immune system disruption drives cancer. That's why they call cancer the flip side of the same coin that's autoimmune disease. The same thing that causes autoimmune causes cancer. Well, this immune system disruption plays a part in heart attacks, strokes, dementia, Alzheimer's, thin bones, osteoporosis is playing a part in all this brain stuff, depression and anxiety. And so, truly, anything that is not quite right is basically a disruption of the immune system and probably a disruption of the gut. And 80% of the immune system surrounds the gut. So, when the gut gets disrupted, it throws off the immune system. And then you have this inability to get rid of inflammation. And wherever you have too much inflammation in your body, that body part has a health problem. Brain, joints, skin, eyes, bones, any place. There's too much inflammation, and that's the immune system. So truly, anything that's not quite right is telling you that the gut and the immune system is off, and it's time to look at why, fix the why so you feel better. Otherwise, it moves towards all chronic disease.
That is very true. And it is surprising how these small signals often become life changing warnings when we take them, uh, when we take even a moment to acknowledge them.
And that's part of what helps with the healing process is just usually you're kind of thinking, well, I'm going to not think about that. Right? I'm not gonna let it bother me, which is, a defensive mechanism. You wanna be able to keep going through your day and not let it dominate your thoughts. But we really wanna think about it and think about why. And then if we're kind of thinking, well, this should be something that I can fix. And by fixing it, I'll feel better. And by fixing it and I feel better, I've now really empowered myself to stay healthy forever. Right?
Yeah.
So rather than thinking of this as something that we shouldn't really think about and don't let over, really it's like, well, I should be able to fix this. I know this comes from something. The science is very clear that this is coming from something. There's no reason I shouldn't be able to fix it. And by doing that, I'm empowering myself to feel great again, but also super empowered to stay healthy and not get chronic health issues like diabetes and these other things that maybe a lot of other people are getting.
So, are there any particular signs that are misunderstood or normalized for far too long?
I think about all signs, and this is why people end up with, 5 medications, 10 medications, 12 medications, because they just keep putting bandages on symptoms and not getting at the root cause. But one of the lovely things is, and I think this is very empowering to know, is when people get a lot of different problems going on at the same time, it can look very overwhelming. It can look very confusing. Even a doctor might say, geez, how can all this stuff be wrong at the same time? I don't know what to do. Actually, it makes it super easy because the only reason why you can get a lot of different problems at the same time is some very important central mechanisms in all health or ill health has been thrown off. But then by fixing these, addressing them, you're in a position to fix everything at the same time. Air is connected, all gets better. And so it kind of makes it easy because we know exactly where to go to figure out why you have one symptom. But also, if you have 10, 20, 30 things going wrong, we know exactly where to look as well.
Very true. I mean, this clarity that you have given us to on this show, that is really going to help our listeners reevaluate things that they have brushed aside for years. And to me personally, also, I feel like I have a lot to think about all these things. Some things that feels just normal, but it can be something deeper.
It can. And no matter how long a person's had a problem, the body has always been trying to fix it and has always known how to fix it. But
Mm.
something got in the way. And you can have something for 80 years and the body's still waiting for its opportunity. You get this thing out of the way, the body goes, I have my opportunity finally. I've been waiting for years, decades. Off it goes and it fixes things. So I have like, like an 84-year-old woman came to me one time and she had a lot of health issues by that time. And one thing that she'd had since 6 years of age was ringing in the ears. But she said, well, I've gotten used to it. It's very strong, but what am I going to do? I've had it since I'm 6, but all these other problems, these are the ones I want you to help me with. But I knew that everything was connected. And if we take care of the right thing, everything can get better, right? Well, we make a couple changes the first visit. We decide to run some labs to get more information. She came back in 6 weeks to go through the labs, but because of the changes we made initially, right in the middle, we'd already started putting her in a position to feel better. And so I said, "Are you feeling any better?" "Well, my stomach, all my stomach problems are a little bit better." I go, "Oh, good." But I ask her, "What about the ringing in your ears?" "Oh my gosh. Oh my gosh. It's gone. It's gone. I've had it since I was 6 years of age." And I go, "Well, I know that because I have it right on my piece of paper," you know? But I needed to ask her that because I had a feeling that that was gonna change fast given what I had seen. And here she was, almost 80 years she'd had that, and within weeks, her body was finally given an opportunity. We got rid of something that had got in the way for 80 years, and it started fixing her right away. So I think that's a great learning tool that no matter how long you've had a problem, your body is still in a position to fix it.
That is amazing. It was actually amazing. And, finding out the root cause of things, I feel like that makes us as a person also feel more amazing that, okay, yes, we did it.
Yeah, and so quickly too. It's like how fast the body can move on this stuff. When
Yes.
opportunity, it's not like, well, if we start fixing you 80 years from now, that ringing in the ears will go away. Well, that's not quite 100. We can't wait till she's 160, right?
Exactly. I'm
Like
seeing that, yeah, I'm seeing that happiness in the patient's face. That is also just another sense of happiness within.
it is, it's wonderful. But like with children, even with children, subconsciously they tell you a lot that they may not be able to tell you verbally. And so, like, if I see I see a lot of children with juvenile rheumatoid arthritis. I see a lot of children with autism. I see a lot of children with a lot of chronic health issues. And fortunately, children heal better than adults. But like when I first see them, they may, they're really feeling poorly. They have these health issues, and they sit by their parent and barely stick their head out over the shoulder, kinda hiding. And I talk to them, and they're very, quiet and hiding. Or back I do everything virtually now, so all my visits are on my laptop, so I can see anybody, any place. But back in the day when I was in clinic, they'd, kinda hide behind the parent in the exam room, right? And we'd talk, we'd figure some things out, we'd make a couple changes, we'd have them come back. And even before I got a chance to ask the parent if it seems like anything's gotten better, I know the child's better. The child runs in, jumps up on the table, and just sits there. Or when we're on my laptop, they jump right on the parent's lap and sit right in front of the screen. And I go, "Oh, hi, sweetie." And they go, "Hi, Dr. B." And I go, "Oh, it's so nice to see you again. Oh, it's so nice to see you again, too." You know that they're better, right? You know they're feeling better like right away. They don't tell you.
That is such an amazing feeling to have and to see and to witness. It's just, and even now when I'm listening to it, it sounds amazing.
Yeah, it's wonderful to see. And this is one reason why I love to see children. They heal better than adults, which always makes my job easier.
Yeah.
But by healing somebody, taking care of things by age 19, you set the system at those young ages, and then you really have put them in a position not to get chronic disease the rest of their life. So that's why it's always nice to see somebody before age 19 because you're making them better, but you're locking them in place for their whole life. But also, if you can help somebody get optimally healthy before they have a child, before they conceive a child, the person is actually able to pass on health to the next 6 to 8 generations. So not only does the person themselves feel better, but we have done our due diligence to make the next 6 to 8 generations of our family healthier by what we do when you get at these root causes, these central mechanisms. It's not just powerful for the person, but it's powerful for future generations as well.
That is very true. So, David, you incorporate nature, acupuncture, and regenerative medicine into your approach. How do these therapy enhance the body's ability to communicate clearly and heal effectively?
So basically, everything that a functional medicine doctor would do and all that I do, which is even more than just functional medicine, you're basically trying to put the body in a position to heal itself. And truly, the body is better at healing things than any medicine we have, anything we do. So if you can get the body in position, it can fix anything better than anything we have. Now, to put the body in that position, though, there's a lot of different things that you might have to do. And so one thing I think is getting somebody empowered, feeling like they know where this stuff comes from. I know I can make it better. I know if I do, I'm going to feel great, and I can actually make myself stay healthy the rest of my life and pass health on to my next few generations. So empowerment is a big one. But also, when it comes to nature, um, humans and nature have, grown up together through the eons that humans have been here. And so, nature, for a long time, we've known that inherently nature helps human health and well-being. And so there's hundreds of different articles about how nature will do this. And I've actually put them all together back like 10 years ago. I put all the ones that were available back then together for medical people and non-medical people. And this is how nature should get outside. So indoor gardening helps human health and well-being. Looking out a window on a green space after surgery, less likely to get post-op complications like post-operative infections, and you can leave the hospital quicker just by looking out on a window over a green space versus a blank wall. Getting into parks and recreational areas and all this. Now, the last 10 years, there's a lot of data coming out about how light impacts us. Sunlight, infrared, ultraviolet, ABC, how that can be positively impact us, but also how artificial light at night, they call it ALAN, ALAN, artificial light at night, is so toxic to us, including when we're talking about like depression and anxiety and all this brain stuff. And so it turns out that the back of our eyes, we have the retina. Now, the retina, for a long time, we thought it was only rods and cones, what they call these image forming retinal cells. So, light, like sunlight, would hit the rods and cones, the image forming retinal cells. They project information up to the part of the brain called the visual cortex so we can see images. Like I'm seeing you, you're seeing me. But then all this stuff started coming out that something was going on in the eyes that could not be explained merely by image forming retinal cells. Turns out there's other retinal cells, and they call them non image forming retinal cells. Light, such as infrared light, that's particularly powerful the first 3 hours after sunrise. So, this is where you might hear some people say, never miss a sunrise. Get your eyeballs, get your body outside within the first 3 hours after sunrise. Now, ideally, no contact lenses, no glasses, no sunglasses. You don't have to look at the sun, just the reflected light is fine. But the light hit these non-image forming retinal cells, and they project to all these different brain parts, parts involved in mood, called the amygdala, parts involved in our emotions, called the perihabenula, the part of the brain called the hypothalamus, which is part of the HPA axis, hypothalamus, pituitary, adrenal gland, which makes the stress hormone cortisol. The HPA axis is how our body deals with stress, and that's tied into immune system, hormones, heart attack and stroke risk, everything. How our body deals with stress is about everything. It projects to a part of the brain called the master clock that oversees the 24-hour circadian rhythm of every
Yeah.
body. It turns out every cell in our body is a 24-hour clock, including the intestinal microbiome that's so important for health or ill health when it gets thrown off, has its own 24-hour clock. It even projects up to the part of the brain involved in metabolism and whether we have a slow metabolism or fast metabolism. So we can use that and the non-image retinal cells to set this whole system in a great place that helps health of all kinds, including when I lectured in Paris last summer, I talked about how 1/3 the way through a pregnancy, about 3 months into a pregnancy, the developing fetus, the developing baby, has 6 more months of body parts to put together. A lot more body parts to put together. But a body part that's already there about 3 months in are the non-image forming retinal cells. No rods and cones, no. The baby's eyes actually start seeing light coming through the abdominal and the uterine wall of the pregnant mother. 3 months into the pregnancy. The non-image-forming retinal cells seeing sunlight coming through the abdominal and uterine wall puts into position all these important brain parts,
Mm.
including setting up a healthy HPA axis. The body sets up healthy ways to deal with stress before it's even born. So the mother might be lots of stress. And when I lecture, I show this great slide where the mother's disrupted HPA axis creates a disrupted HPA axis in the developing fetus even before they're born, so that their whole life they don't deal with stress well and they get all these health issues. But with the baby's eyes seeing light, it sets up a healthy HPA axis, even if the mother's all stressed out. And because information goes to that master clock, this is why a baby's circadian rhythm is is set up independent of the mother during pregnancy. The baby might be asleep when the mom's awake. The baby might be awake when the mom wants to sleep. This is how a baby even sets up an independent circadian rhythm for the mom during pregnancy. So this is where during pregnancy, I kind of talk about, okay, all these ladies who are pregnant, get outside, lift your shirts up, loud and proud. Let the sunlight hit your abdomen so the baby's eyes can see the light. Now, a big study came out about 3 months ago, 5 months ago, that this actually works through clothing. And that makes it even easier because it comes through clothing. It's not quite as good as without clothing, but it's really, really good even through clothing. So just getting outside, letting babies see light coming through the abdominal uterine wall is how we set up everything, including the intestinal microbiome. But these are methods that we can use to reverse, well, to stay healthy, prevent disease, but also to reestablish health in somebody who has already developed a lot of chronic health issues. The body's
That that is actually very smart and so fascinating. And this is something I am hearing for the very first time. And I hope my listeners are going to be so happy to hear this and it is going to be so insightful for them as well. So, David, before we officially wrap this up, for our listeners who want to learn more about your work, your research, or your clinical resources, where can they connect with you?
So they can get to me on drdavidbilstrom.com. No, no periods, no spaces, just my name. And then on my website, amongst other things, is a free online educational email course that is designed to help people understand why they don't feel well and how they can fix this themselves. So 7 emails, one a day for 7 days, only about 6 to 8 minute read to teach you why you're not feeling well and how you can fix this yourself. And then I have a lot of blog posts, such as Early Morning Sunlight blog post,
Mhm.
uh, Artificial Light at Night, how toxic artificial light is, slash notes from Paris. So I have a lot of blog posts about these real big central mechanisms that produce disease, but how we can reverse it as well.
That is amazing. I will make sure to include all these details into the show notes. And so, David, thank you so much for offering such uh, clarity and grounding appearance. Your work reminds us that body is always speaking. Healing begins the moment we choose to listen. To everyone turning in, may you begin paying attention to small signals, honoring your body's wisdom, and choosing a path that seeks restoration rather than temporary relief. Better health begins with a better understanding, and your next step towards healing start today. And if this conversation supported you, follow, leave a review, or subscribe us. Your echo helps this healing circle grow wider, softer, and more alive. Until next time, I am Nazish, and this is Healing Mindset. Thank you so much.